Welcome to this video presented to you by the National Medical Clinic Group of Companies. My name is Jay Wheatley. I'm Director of Patient Services at National Medical Clinic. I'd like to welcome you today in this particular video in a series produced by the National Medical Clinic Group. The National Medical Clinic Group of Companies consists of Metagenics Inc., American Medical General Inc., and National Medical Clinic Inc. We operate throughout the United States providing patient services, and we began 15 years ago. Today we're going to talk about the question of testosterone therapy and the more specific question of what are the two most effective methods of testosterone therapy in the US today. And then we're going to answer the question of why. The two most effective methods of testosterone therapy in the US today are: one, testosterone, HCG and Anastrozole, continuous hormone therapy for men. The second one is cycle testosterone and HCG with continuous anastrozole therapy throughout the process of treatment. So the first one is the continuous administration of 3 medications. The second method is the administration of testosterone cycled with HCG, and then the continuous administration of anastrozole throughout the process. In talking about testosterone therapy, common symptoms encountered by men of all ages, ranging from roughly 30 up, include chronic fatigue, lack of energy, declining sex drive, declining sexual performance, weakening strength, declining endurance, loss of lean muscle mass, increasing body fat, depression or mood swings, and insomnia or other sleep disorders. The benefit of effective testosterone therapies that we're going to talk about today is that they treat those symptoms. In other words, of course, a man on testosterone therapy, effective testosterone therapy, at least in our experience over the last 15 years at National Medical Clinic, is that they increase their sex drive, their energy, vitality. They increase their endurance, their lean muscle mass if they exercise, their strength if they exercise. They resolve the insomnia issue or have less sleep disorders. They diminish the depression or eliminate it. The mood swings diminish or cease. And overall, they have a better sense of well-being and vitality. It gives them a zest for life again. And this is because testosterone is among the most important hormones in a man's body. I'd like to talk to you first about the two methods of testosterone therapy. First, I'm going to talk about the continuous administration of testosterone therapy with anastrozole and HCG medications. If you're interested in these therapies following this video, you can contact National Medical Clinic Group of Companies by contacting National Medical Clinic at 1-800-582-0095, 1-800-582-0095. And of course, we're on the internet. We're located at nationalmedicalclinic.com, again, nationalmedicalclinic.com, or testosteronetherapy.com. Again, that's testosteronetherapy.com. And you can contact our offices, and we'll be glad to tell you about the process for enrollment and commencing treatment in your part of the country. And referral to a physician would be a member of the National Organization of American Physicians. And the National Physician Referral Service helps us in that regard, and we also are involved in this management. Now, looking at the first treatment, the continuous administration of all 3 medications, testosterone, HCG, and anastrozole. Why is this treatment so effective? It's a leading treatment today. It's one of the top 2, both of which are offered and developed by National Medical Clinic. They're effective because, in the case of the continuous method, a portion of the daily increased production of testosterone is naturally derived from the stimulation of the male testes by the HCG that's being periodically administered throughout the month, along with the testosterone and anastrozole. So that means that part of the increased production that the man incurs is naturally produced. and therefore he's less dependent upon the testosterone medication, which is a drug. And to the extent you can have naturally produced testosterone, that's always advantageous because there's less opportunity for any adverse side effect. There isn't an adverse side effect in the two feeding methods because of the reasons I'll explain to you. But if you were to administer testosterone therapy only for a sustained time period, your endocrine system would sense that. It would affect your pituitary gland. It would diminish your LH, or luteinizing hormone secretions, and that would reduce your stimulation of your testes and diminish and decrease your testosterone production because your endocrine system tries to maintain a balance. And when it sees an increased testosterone level above your genetic level, it begins to decrease your natural production to compensate. The role of HCG in these two treatments is to stimulate your testes and to interrupt that negative feedback loop provided by your endocrine system. By interrupting that feedback signal, it stimulates the testes to produce more testosterone. In the continuous method, this is ongoing every week. And so there's no opportunity for a diminution or a decrease in your natural testosterone production as a result of the therapy. Also, it prevents any testicular atrophy from testosterone therapy. And when you hear about adverse side effects that others have encountered on testosterone therapy, generally speaking, you'll find they were only on the testosterone medication and they were not administering HCG or anastrozole with it. So, one of the main reasons that the continuous method is so successful, and one of the better methods in the United States, is that it's constantly stimulating the testes to produce natural testosterone. The HCG is also used in male fertility treatments, but this is not intended to be a male fertility treatment. Because in male fertility treatments, other factors are involved and other tests are involved. You have to have a sufficient FSH or follicle stimulating hormone in addition to testosterone therapy increasing. So we're not talking here about a fertility treatment. We're talking here about the use of HCG to protect your body and to increase your natural testosterone production. Another reason the continuous method is so good is the anastrozole is constantly administered throughout the course of treatment. For example, if you're doing a testosterone injection, the same day you're going to be doing an HCG injection and you're going to be taking an anastrozole tablet. The benefit of anastrozole is that it prevents the aromatase conversion of increased testosterone to estrogen. If we put you on the testosterone and HCG only, yes, we could raise your testosterone level to an optimum level, but not above the normal range for men, because there would be adverse side effects. But we could raise you, generally speaking, most all men to an optimum level with testosterone and HCG. But you can't just use those two medications. You have to also use anastrozole. That prevents the testosterone from being converted to estrogens and causing you adverse side effect as a male patient, including prostate problems. So we don't want your estrogen levels to rise. We don't want your estradiol level on your lab test during treatment to be above the normal range for men. Therefore, you're going to be taking anastrozole throughout the treatment process to protect you from the conversion of your increased testosterone from being converted over to estrogens. Therefore, you have the benefit of three medications: natural stimulation of testosterone production by the testes through the administration of HCG, which also prevents the loss of natural production during treatment and testicular atrophy. You have the testosterone medication, which enables the doctor to adjust your dose following lab tests during treatment so that the doctor or medical provider can elevate your testosterone level to your optimum level for you. And then, of course, you have the anastrozole being administered at the same time, preventing the increased testosterone due to the medications, both HCG and testosterone, preventing the increased testosterone from being converted to estrogens. So it's an ideal balanced treatment. And it's probably the leading treatment we offer, certainly the most effective treatment in the United States. The other very effective treatment, which we've been providing for 15 years, involves the same three medications. And those three medications are testosterone, HCG, and anastrozole, the same three that were in the continuous treatment. The continuous treatment course involves the 3 medications being administered at the same time, unless you're taking testosterone gel or cream. In the continuous method, if you're taking testosterone gel and cream, periodically, every week, you're taking HCG and Anastrozole, but the testosterone cream or gel is administered every day. So that's what we mean by continuous. They're being administered every day, and the HCG and Anastrozole at the same time, roughly twice a week. So if you're doing injections, testosterone injections in the continuous method, then all 3 medications, testosterone, HCG, and Anastrozole, are administered on the same day. So that's what we mean by continuous treatment. When we talk about the second treatment, now we're talking about testosterone medication being taken for several weeks, 10 to 12 weeks at the most, and then 2 weeks of HCG only medication, except for the fact that in the cycled method, where you have several weeks of testosterone followed by 2 weeks of HCG, that's the treatment cycle. And it can be an 8-week cycle, 12-week cycle, 14-week cycle. But generally speaking, they run 12 to 14 weeks combining both medications. In the cycled testosterone therapy, the anastrozole is taken throughout the treatment, just like it is in the continuous method. And you want to take the anastrozole throughout the treatment because, again, you want to prevent the increased testosterone from being converted to estrogen. Now, in the cycled method, testosterone is the only medication elevating your testosterone level during the period that it is administered. That could, if you continue that, diminish your natural production and cause testicular atrophy. To avoid that, in the cycled method, you stop the testosterone after several weeks, as determined by your treatment protocol, your National Medical Clinic treatment protocol, and your doctor. And you continue on with the anastrozole, but then you do HCG only for 2 weeks. And the HCG stimulates your testes to produce natural production and natural testosterone production for those 2 weeks. It's derived from the stimulation of your testes. So you have, in the cycle method, several weeks of testosterone only, followed by 2 weeks of HCG. The HCG is administered to prevent the loss of natural testosterone production due to the administration of testosterone, and to prevent testicular atrophy due to the administration of testosterone therapy. Again, the anastrozole is administered throughout the treatment period to prevent the conversion of the increased testosterone to estrogens. These treatments are both highly effective, and those are the reasons they're highly effective. Further reasons for that they're highly effective is because the approach the National Medical Clinic takes to testosterone therapy and these 2 methods, as well as other treatments that we offer. And that's essentially that for 15 years in treating patients for testosterone deficiency, low testosterone, and other problems, we've developed a number of treatment protocols or treatment plans. These are written protocols that our doctors refer to throughout the United States in treating a patient. So you're not just relying upon the experience of one doctor or one clinic. You're relying on the experience of many doctors over 15 years contributing to these treatment protocols and what was effective. We incorporate these effective results and methods into treatment protocols. There are roughly 36 different protocols for testosterone therapy alone. These protocols or treatment plans are available to the doctor. When you're on therapy, you'll get a copy of your protocol as well as patient treatment instructions in writing. The advantage of the protocols is that they not only include the experience of doctors over 15 years in treating patients for low testosterone, but they provide a method for achieving the treatment objectives. They define the treatment objectives and thereby secure the results. The treatment objectives of testosterone, HCG, and anastrozole therapy are 1, to elevate the male patient's testosterone level to an optimal level, but not outside of the range, because if it was higher than the normal range, it would be too much for the HCG to compensate for, and it would diminish your natural testosterone production. So your treating doctor or medical provider, a National Medical Clinic independent provider, is going to keep your testosterone level within the normal range, but try to keep it at the optimum level. The second treatment objective in testosterone, HCG, and anastrozole therapy, regardless of whether it's cyclic or continuous, is to keep your estradiol level within the normal range. This tells the doctor that your testosterone is not being converted to excessive amount of estrogens and thereby defeating the purpose of the therapy and causing adverse side effects. It tells your doctor that estrogens are not being excessively produced as a result of the testosterone therapy. The doctor may have to increase your anastrozole dosage if the doctor finds out that your estradiol level is beginning to exceed the normal range. Just like the doctor will test you during treatment, and if your free testosterone level is not at the optimum level, they will increase your testosterone dosage, but not above the normal range. So the way that they achieve the treatment objectives in a successful person is first they define the objectives. So the doctor's looking at your free testosterone level. Is it at the optimum level? And is your estradiol level normal? Through scientific laboratory testing during treatment. Of course, from the patient's viewpoint, successful as they realize increased energy, vitality, sex drive, endurance, better sleep, loss of insomnia, elimination of mood swings and depression, and other benefits of testosterone therapy. Those are the subjective benefits. If we achieve the objective benefits by lab tests of an optimum testosterone level and a normal estradiol level, then in 90% of the cases or more, then the patient's going to realize the benefits of testosterone therapy without an adverse side effect, because we're watching for that throughout the process through these objective tests. And that's what makes National Medical Clinic treatments unique, because we have these protocols. We have standard written lab test objectives. We have a procedure for time periods during which to do those tests, and a response that is required in terms of adjustment of dosage. We have the staff and the doctors to help the patients secure these objectives and make these dosage rate changes. Therefore, it's the execution of the treatment plan or the protocol that also becomes important. You could have the greatest treatment plan in the world, but if you don't follow the protocol, you don't have a means of achieving those objectives, and you don't do the lab test during treatment, and you don't adjust the dosages appropriately, you give another greatest treatment in the world, greatest treatment plan or protocol. It won't do you any good, because you have to have the follow-through, and you have to know how to adjust dosage based upon those lab test results. Therefore, that's why we believe that National Medical Clinic's 2 hormone replacement therapies for men are the most effective in the country today. The first being the continuous testosterone, HCG, and anastrozole therapy for men, and the second being the testosterone and HCG cycle therapy with continuous anastrozole. Following a treatment plan or written protocol utilized by the doctors in your treatment. Utilized by the doctors in determining what adjustment to dosage needs to be done to achieve those treatment objectives. If you would like to learn more about National Medical Clinic hormone replacement therapies for men and the process for securing treatment, if it's indicated for you, please contact us and we'll be glad to answer your questions and enroll you. The only way you can enroll with us is on the phone. You can't do it online. So please contact us at 800-582-0095, 800-582-0095. Call us now if you want to start treatment or secure more information about our treatments. We'll be glad to answer your questions. There are videos on the websites that also answer questions. NationalMedicalClinic.com is one website. I mentioned earlier, NationalMedicalClinic.com. Another website that has abundant information and medical articles about testosterone therapy is our site, testosteronetherapy.com. Again, testosteronetherapy.com. So call 800-582-0095. Again, 800-582-0095. If you'd like more information about our testosterone therapies, why are they leading therapies in the United States, why are they effective, how we achieve that effectiveness, now you can enroll in one of these treatments and change your life. Thank you for listening to this video, viewing this video, and have a good day.